So ladies and gentlemen, please put your hands together for our first speaker this evening, Mrs. Suzanne Peponis-Brisimus, founder of White Pearl Foundation.
Thank you, Cleo. That was a really lovely introduction and you're doing a wonderful job. Ladies and gentlemen, Cleo, we need a round of applause for Cleo because he graciously volunteered to do tonight's emceeing. It's not an easy job keeping this amount of people listening, and I think he's doing a terrific job. So thank you very, very much, Cleo. Really, thank you. We're so grateful to all our guests for joining us this evening. We put out the call and you responded very, very generously. It really has been a pleasure for us at White Pearl Foundation to bring this event to the community, alongside our very good friends from Cquence Foundation, and of course our lifelong friends from our afternoon Greek school days at our beloved All Saints. I've been asked to introduce our guest speaker, representing the charity to which half this evening's proceeds will be donated, the Brain Cancer Group. But yes, please, they do amazing work. But before I do that, some background as to how we got here. White Pearl Foundation was established in memory of my mother, Christina Peponis, who passed away from a very aggressive brain tumour, a glioblastoma multiforme. The Foundation's purpose is to raise funds for the research programs of the Brain Cancer Group, housed on the Royal North Shore Hospital campus in St Leonards. Our fundraising has enabled us to fund brain cancer researcher salaries, PhD programs, provide seed funding for newer projects and buy much needed equipment for the lab. And this evening your generosity will be donated to an Australasia First initiative, the Brain Cancer Imaging Laboratory, that was curated and continues to be led by the Brain Cancer Group's Associate Professor Michael Back, radiation oncologist. And as I look around the room, I know some of you know Michael, because unfortunately you've had to deal with him because of illness in your family. Working closely alongside Professor Back, developing and implementing the programs, is tonight's esteemed speaker, Dr. James Drummond, the inaugural radiology chief of the Brain Imaging Laboratory. James has a mixed clinical academic research appointment at Royal North Shore Hospital and is actively involved in multiple clinical trials. James' areas of expertise include all aspects of neuroradiology, including brain and spine. He has particular interest in neuro-oncology and MRI research, including machine learning and use of AI in radiology. A most entertaining speaker, a most knowledgeable speaker. Many of us were captivated at this year's Breakfast for Brain Cancer when Jamie spoke. Ladies and gentlemen, it's a real pleasure to introduce Dr. James Drummond.
Good evening, ladies and gentlemen. You have to give me a little bit of rope. I'm reading from my phone, and it's getting harder and harder in the dark. So thank you first, Suzanne. Ladies and gentlemen, what a pleasure it is to be here and talk to you about some of the work we've been doing. Many of you don't know me. I'm Dr. Jamie Drummond. I sit in the shadows. I'm a neuroradiologist. You don't often get to see radiologists, and I'm thankfully one of the very lucky researchers that gets to use some of your kind donations. So please keep them coming this evening. We need as many donations as we can get. Convincing a radiologist to leave the dark is not an easy order. We like our space and we like the dark. And Suzanne has convinced me twice in 6 months to do this. But there's nothing better than celebrating the 70s, because I'm a researcher that wasn't born in the 70s. So it's nice to see a new generation of researchers at my table that weren't born in the 70s. Although I feel like a fraud here, sitting next to an Order of Australia neurosurgeon sitting at my table, Ray Cook, who founded the Brain Cancer Group. It can't be said enough this evening, but Suzanne, it's unbelievable, these events that you put on. And I don't think people say it to you enough, Suzanne, but your mum would just be incredibly proud of your efforts. Now, it's been a few years since I've been at a ball, and my dinner jacket and my waist is definitely feeling it tonight. And I've been told I have 10 minutes to give a speech about brain cancer, which is probably not the most uplifting subject to talk about, particularly when so many of our families and friends have been affected by this in this room. My darling partner Libby told me, keep it light, which is a challenge when you're talking about probably the deadliest and most difficult cancer to deal with. Progress feels slow sometimes, and progress feels particularly slow in brain cancer. And when you live with cancer, and I can speak personally, and when you support loved ones with cancer, and when you lose people to cancer, progress feels even slower. And we have to remind ourselves, particularly in brain cancer, that it's small incremental gains that can be as impactful as revolutions and moonshots. So I'd like to share a few of the things that we're doing at the Brain Imaging Laboratory through the Brain Cancer Group that really build on these small incremental gains. And then at the end, I'm going to talk about some moonshots. So the Brain Imaging Lab is founded on Royal North Shore. We're a decentralized service, so we have no particular office, but we have a lot of hardware and a lot of software scattered across the campus. Our goal initially through the Brain Imaging Laboratory was to make sure that we had the best brain cancer imaging in Australia. And I'm pretty sure now that we do. We provide an exceptional service on our imaging. The imaging is getting quicker, it's getting better, it's getting more tolerable for our patients. We bulk bill everyone that comes through the Brain Cancer Group and our group on the North Shore campus. And we are a multidisciplinary group of physicians that fundamentally believe in public care for our patients. Our patients aren't selected into who gets advanced technologies and who gets advanced imaging. Everyone gets advanced technologies and everyone gets advanced imaging. We've been lucky in the last 8 months that we're the first site in New South Wales to get a total body PET scanner supported with the University of Sydney and Royal North Shore Hospital. And the amount of amino acid imaging, and the amount of PET imaging we're doing is quite extraordinary. It's must be almost the leading site in Australia, if not in the world. And when you go to the US and work in the US, you just see how far ahead we are of the United States. There's been some incredible work by our PhD candidates looking at PET imaging and looking at FET imaging. And we've been doing a huge amount of work trying to improve our radiation therapy in our patients, making it more tolerable and reducing the risk of recurrence. We offer an incredible program in meningiomas. We offer a therapy that we're only one of 2 sites in New South Wales offer, lutate therapy. And we're doing more and more imaging with PET in both glioblastomas, high-grade gliomas, and meningiomas. The Brain Imaging Laboratory is not just about imaging, though. It's also about teaching. And we teach the next generation of radiologists, the next generation of neurosurgeons, and the next generation of radiation oncologists to really focus on how important imaging is in cancer journeys. Overseeing research of doctoral candidates, postdoctoral researchers, and radiologists is intrinsic to the Brain Imaging Laboratory's role, and we currently have 2 postdocs through the University of Sydney that work with us in the BIL, and also we have 2 internal PhD researchers who are funded by the Brain Cancer Group. So things we're doing locally are very important. We're trying to pioneer and push for our brain cancer patients, but it's also our collaborations that are really pushing ahead in the last 6 months, and now we're really trying to forge ahead in the next year. We have incredible local collaborations with the University of Sydney's lead researchers at ImageX. We've got some incredible clinical trial research agreements with Memorial Sloan Kettering in New York, with the Martinos Center at Harvard University, and with University Hospitals in Cincinnati. We have incredible tech access agreements with Siemens, who we owe a lot of thanks to for their access, through local Sydney neuroimaging research centres at the Brain Mind Institute and with St Vincent's. And we're also now the premier site for neuroradiology. We've attracted 6 neuroradiologists to our site in the last 12 months, and there's only about 10 of us in Sydney, so it's been a nice poaching exercise. Finally, I really want to talk about the Brain Cancer Group and why it's so fundamental to what we're doing. Australia has a real problem that there isn't enough money in research. Now, we're not unique in this. This is a problem for the rest of the world. And it's one of the few things when you go to the United States and you work in the United States, they really do support their researchers and make funds accessible. And Australia has made it increasingly difficult to draw funds from the government for investigational and translational research. And when we have access to funds through a group that doesn't demand endless logistical applications and bureaucracy, it changes our ability to do research. It frees us up from the tedium of applications, of bureaucracy, of convincing people that you're worthy of their investment, and it allows us to explore and investigate areas that we otherwise would never have backing. Fundamentally, the Brain Cancer Group has been hugely reliant on the Greek community. And the Greek community, with its generosity and its investment through the White Pearl Foundation, has been the backbone of research on the North Shore campus. And you should be proud. Of all our communities in Australia, you should be proud of your generosity and your involvement in all of these areas of research. There's incredible technical support through the Brain Cancer Group. We have clinical trial coordinators, we have operations managers, we have multidisciplinary input from our team. There's capital support for infrastructure, for software, for scanner improvements. But the main thing the Brain Cancer Group gives us is time. And time is what we all want more of. Whether it's time with your family that is sick, with your patients that are suffering, with your patients that are undergoing treatment, getting people time is our goal. And the Brain Cancer Group gives clinicians more time. It lets us step back from our clinical demand and focus on new areas of interest and new developments that we can offer our patients. So what's next? So I don't want to sound too much like Elon Musk. I think he's a bit on the nose now. But I'm going to talk about two things in particular that I see happening in brain cancer, and where I hope we can try and catch up with some of the revolutions that have been happening in the other cancers. And brain cancer really is a challenge beyond cancers in the rest of the body. The first thing is data. Data is king, and artificial intelligence is coming for our jobs. 10 years ago, the father of AI, modern AI, Geoffrey Hinton, said, we should stop training radiologists. And a lot of us panicked in the industry, thinking, maybe it's true. Maybe I should look for work somewhere else. Real estate agents, Badger Fox, I'm looking for a new role. And we were all a bit worried as radiologists that AI was coming for us. And it's definitely going to have a significant impact. We've started 2 pilot projects on the North Shore campus, looking at the implementation of AI in brain tumors. So the way we look at brain tumors now is with a computer backend and a deep learning model to help us segment, measure, monitor brain tumors. And this is all in the investigational stage, but it's going to have a significant impact on how we manage patients. Really, when we look at patients and we look at their imaging before they have an operation, a lot of what a radiologist does is educated guessing. We try and predict what patients have on their scan, and then we rely on the neurosurgeons and our pathology colleagues to tell us what the absolute answer is. But with the advent of AI and the implementation of AI into imaging, we can now predict what type of cancer you're going to have. Within that, we can predict what subtype of cancer you're going to have. We can predict through AI modeling where the cancer will recur. We can predict how it's going to respond to therapy. And we can predict how you're going to survive and how you're going to tolerate your treatment journey. And as we implement more and more AI, we're just going to get better and better management for these patients, which allows us to do better surgery, to reduce their morbidity and their side effects, to give them better radiation oncology, and to give our patients longer survival. Cancer shouldn't be a death sentence, and when you live with cancer, you try not to think of it as a death sentence. In the end, all of our bodies age and we all get some kind of ailment, and cancer should be something we can all live with, and brain cancer will get to that stage too. And the next step that I see in brain cancer research, which is what the next 6 to 18 months I hope to try and implement, is that we're going to try and take a molecular approach to your brain cancer. So on a personalized level, if we know what your brain cancer type is, we should theoretically be able to image exactly the molecule that your brain cancer is producing or your brain cancer expresses. And so in the next 6 to 18 months, a lot of our focus is going to be on small animal work and research, looking at how we can do PET scans to target specific molecules in your brain cancer. Not only that, but when you target specific molecules in your brain cancer, you can theoretically see preemptively, I'm going to give this patient 5 drugs, which one binds to the cancer best? Which one goes to the cancer most effectively? So in the next 12 to 18 months, we're hoping to try and produce some of these molecules, test them in small animals, and then try and rapidly get them into the clinic so that we can offer our patients new ways to image and theoretically new ways to treat. One of the biggest issues in brain cancer research is trying to focus. It's very easy to take a broad scope, and when the brain cancer group gives you a lot of rope, it's easy to run away and get interested in lots of different things. And the way to focus is to be multidisciplinary. And more, we're bringing more and more experts into the room, and we're trying to focus on the same goals. And the goals are to keep our patients alive, well, enjoying their life for longer. It's an exciting time in brain cancer, if brain cancer was ever exciting as a term. It's definitely playing catch up to a lot of the other cancers. There are a lot of thanks I need to give, particularly Dr. Cook, Dr. Parkinson, the neurosurgeons, the Brain Cancer Board, the medical oncologists, Helen Wheeler, Adrian Lee, and I particularly need to thank Prof. Michael Back, who's not here, who's been an incredible mentor and guide for me in the last 2 years. I'm really looking forward to 2025 when I get some more time to work on research projects as I step back from some clinical work. And most of all, I want to thank you all for your contributions, your support, and your ongoing funding of our work. Thank you.
As Dr. Drummond said, I don't think we realise how fortunate we are to be in a country like Australia, and more fortunate still necessarily that committees or foundations like White Pearl exist to assist in their research and their funding of further research in this terrible and insidious disease. Ladies and gentlemen, I'd ask you once again for a big round of applause for Dr. Drummond, who I'm sure spoke admirably well enough for us to all understand what's involved. And now, ladies and gentlemen, I'd like you please to put your hands together as Mr. Walters makes an appearance for the first time tonight. Suzanne would like to present Dr. Drummond with some roses. I'm sure they're roses. It says Mr. Roses. I guess they're roses. Doctor, thank you very much. Thank you for your presence here tonight. Ladies and gentlemen, the next speaker this evening is indeed someone who will tug at your heartstrings, as he has undoubtedly to mine, for various reasons. Obviously, probably I'm a little bit closer than most in this room, but more importantly, he's someone who's been touched by this insidious disease more than most, and who has battled on, along with his extended family, to be here tonight to speak to us and share with us the importance of being here and funding the research that we are doing tonight. Ladies and gentlemen, from Cquence Foundation, I give you Mr. Jethro Clayton.
Sorry, Claire, I'm going to have to move this up. Ladies and gentlemen, distinguished guests, a very good evening. For those who don't know, Yotta, my late wife, started Cquence Foundation. She quickly realised that having a rare and advanced cancer is costly in every facet of the word. Her aim was to make the journey for some that little bit easier. It was an act of kindness that she decided at the very start of her cancer journey. For our team, Yott's family, and myself, her legacy is now our purpose. It is a vocation, not a job. It is a duty, not a chore. And as it is the same for the White Pearl Foundation, it's something we wish we never had to do. For our families, however, life has no better meaning. Now, although we miss her love every single day, the irony is it gets pumped back to us through the gratitude and kindness through event sponsors and events like this evening. It comes back to us through the incredible generosity of this evening's sponsors and seeing each and every one of you donning your evening finest. And from my vantage point up here, you're an exceptionally fine-looking crowd, especially considering most of you had to be born to have enjoyed the 70s and 80s, unlike some of us young'uns born in the 70s and 80s, although it is likely we were only conceived thanks to you guys enjoying the 70s and 80s a little bit too much. Thank you, mums and dads in the room. Now, I don't have the words to eloquently express my gratitude as well as my late wife could have, but we are forever thankful and indebted with servitude for this amazing attendance and support. It is incredible. Now, Cquence has come a very long way in a very short time, and it's only thanks to events like tonight. Every single bit of kindness, and let's be honest, as we're mostly among friends, money, helps make the journey for some cancer patients that little bit easier. Now, in addition to helping patients directly, we also established a PhD scholarship at the Global Centre for Gynecological Diseases. And tonight, we are proud to announce we have entered into a partnership with the Prince of Wales Hospital. We are formally committed to donate $500,000 over to the Cancer Survivorship Centre over the next 3 years. Now, donations of this significance would not be possible without help. Remember that all donations from Cquence this evening go directly to the Cancer Survivorship Centre. Now, we are privileged to have Professor Chua, who is responsible for this initiative, in attendance to share the centre's mission. I've been privileged to meet Professor Chua on a number of occasions now, and her humility, compassion, and her kindness have shone through every time, as I'm sure it will this evening. She is the kind of oncologist you want in your corner and running a centre like this. Please join me in welcoming Professor Chua to the stage.
This is often my first act when I get on the lectern. Good evening, and thank you, Peter and Jethro, for inviting me to speak at this gala function in support of the Cquence Foundation. And I have to say that your strength and your compassion are truly remarkable and inspiring. Thank you. And on behalf of all the patients and the staff of the Lund Comprehensive Cancer Center at the Prince of Wales Hospital, and I extend my most sincere gratitude for your support of Prince of Wales Hospital Cancer Survivorship Center. I think it is pleasing to know that Australia, we in this country, has one of the highest cancer survival rates in the world. And currently, we have about 1 million cancer survivors in this country, and this number is expected to double in the next 10, 15 years. However, I think many of us would know that cancer patients are at risk for serious adverse physical, psychosocial, and economic consequences of cancer and the treatment for a significant period of time beyond the diagnosis and treatment of cancer. And as I've said, with this expanding population of cancer patients, the current models of cancer survivorship care are inadequate, grossly inadequate, to address the unmet needs of our patients, and is unlikely to be sustainable for the future. And such is the clear and compelling reason for a cancer survivorship program to empower our patients as equal partners in preventing and managing the adverse consequences of their cancer and their treatment. And therefore, the establishment of the Prince of Wales Hospital Cancer Survivorship Centre signifies our commitment to reducing the devastating impact of cancer on our patients and their families. And our cancer survivorship program has 2 pillars. So firstly, we have the Cancer Inspire program, which aims to inform and empower our patients and families through small group interactive education events that are facilitated by our multidisciplinary team of health professionals, including medical, nursing, and allied health. And secondly, we have a cancer survivorship clinic that is supported by our experienced team, including cancer specialists, exercise physiologists, psychologists, and a dietitian working together, closely together, to provide a one-on-one assessment and support that is tailored to the needs of our individual patients. No two cancers are the same, and no two patients are the same. And recognizing the significant risk of cardiovascular complications of some of our cancer treatments, and we have recently established an innovative cardio-oncology clinic to prevent, promptly recognize, and effectively manage the cardiovascular complications of cancer treatments with the hope of improving the outcomes of our patients. And this is the first in New South Wales and one of the first of its kind in Australia. And this reflects our proactive approach to addressing the treatment complications of our cancer patients. So far, our cancer survivorship program has been supporting patients with early-stage cancer who have recently completed treatment, as this is a time of unique cancer survivorship needs for many of these patients when the frequent contact with their care providers often abruptly decreases. However, improvements in the cancer treatment, and these patients with advanced cancer are now living longer, months and sometimes years, but often at the cost of complex physical and psychosocial symptoms as they face an uncertain future. And yet, many of these patients are often overlooked in cancer survivorship research and service provision. And at our Cancer Survivorship Centre, we aim to develop and also test innovative models of comprehensive and personalized cancer survivorship care. Although it is unconventional nationally, internationally, we recently broadened our program to include patients with more advanced cancer. And this will then enable these often overlooked patients to access the much needed resources and services to address their unmet needs and improve their overall health and well-being. Our survivorship program is driven by a strong research agenda as we aim to build the evidence base and also strengthen the quality of care for our patients. And not only that, we also invest in the training and education of the next generation of clinicians and researchers in cancer survivorship in order to deliver solutions for the challenges of cancer survivorship care. However, above all else, our Cancer Survivorship Centre is a sanctuary for patients where they feel safe, where they feel supported, and where they feel welcomed. And together, our Cancer Survivorship Centre and the adjacent Naloon Comprehensive Cancer Centre of Prince of Wales Hospital, these two facilities are complementary in the provision of whole-of-person cancer care. I've always said that it is an overwhelming privilege to serve our patients. And in all that we do, there is no greater purpose. And I look forward to working in partnership with you on this journey. Thank you very much, ladies and gentlemen.